Today I'd like to talk about a way to approach differential diagnosis in general, not just in rheumatology, but everywhere. This is not new information, but I want to frame it so that when we get to rheumatology differential diagnosis, it'll always be within this framework. So first, what I'd like to do is start with what's called the Gestalt diagnosis. Now, Gestalt or Augenblick diagnosis is really just your first impression. And everybody does this. And it's normal and natural, and we should all do that. So when you hear that somebody that's a 60-year-old diabetic with hypertension and high cholesterol is having substernal crushing chest pain, you should think MI as your first thing. Now, it may not be that, but that's what you should do first. So Gestalt is the first thing that comes to mind. Gestalt is good. It's the way we always start. But what you have to remember is it's not usually correct. And so you have to have another step after that. Otherwise, you're just going to be wrong too many times. So with the Gestalt diagnosis, you should think of it and then go back and check your hypothesis against all the data about what's happened previously, about what you see now in the history, what in the physical exam, what in the labs, on the studies, and project forward as to where you're going. So that's the place to start. Now, the second thing you should think of is what is the worst thing that this can be? Now, this is a normal approach in the emergency room. And in the same patient, you would not only think, do I think this is an MI? Do I think it's a dissection? Do I think it's a PE? You're going to want to think of those things. Now, it probably isn't those things, but you need to make sure that you aren't missing the worst thing. So first Gestalt, then check all the data against it, then the worst. And then I want to get to the last one here, which is the what's broke approach. Now, this is the one that all internists use, and this is the one where we're going to land. And I wanted to frame this because I'm going to teach you how to do differential diagnosis in immunologic disease. But what you have to decide is, out of all the signs and symptoms that are going on, what mechanically is actually not working right in the body? What anatomically is not right? What is not physiologically not right? You have to decide out of all those things, what is it that's not working right, and start figuring it out from there. Then after you've decided what's broke, you also have to figure out what else is broke, is the number of organ systems that are also being affected by this. And so once you decide what is broke, then you need to decide how extensive the problem is and how many organ systems are affected, how severely they're affected, and also stratify in terms of what is the most critical organ involved, and that'll help you to understand where you're at. When we talk about differential diagnosis in rheumatology, it's always framed within the internal medicine approach of Gestalt, checking against the pros and cons of that diagnosis, making sure you're not missing what's worse, and then going into then what actually is broke, how extensive is it? Is it single system? Is it multiple organ system? And that's how we're going to frame rheumatology differential diagnosis.